So welcome everyone. Today we will be talking about what palliative care is and how it's different from hospice. So this is our current Angela Palliative Care team. We're small, but we are pretty mighty right now. So that's pretty exciting. So palliative care. Palliative care is a resource for anyone who's living with a serious or chronic illness. The objective for palliative care is to improve one's quality of life by creating a care plan that matches one's individual goals and values and beliefs. We work currently side by side as an extra layer of support that works with the current healthcare team. So it often goes side by side with hospice, palliative and hospice care. Hospice is its own thing, whereas palliative care, you don't have to stop going to your primary care. You don't have to stop your physical therapy. You can continue with home care, seeing specialists, and have palliative care on as well. So the focus of palliative care is, again, to enhance someone's quality of life by identifying one's goals of care and making sure that that goal is what we're striving towards. We do that by discussing symptom management. We do that with discussing advanced directives and talking about power of attorneys and living wills and code status, including full code or do not resuscitate. All these things that kind of help someone figure out what their goal is and that they don't have to do certain things that might be offered to them in their care from their doctors or from the hospital. And then our team also communicates with that patient's primary care provider by sending our notes to allow for the patient-centered care to remain with that primary care provider. The focus of hospice care, on the other hand, is to provide a holistic care for someone who's no longer seeking curative or restorative treatment, or those options might not be there anymore. And the entire focus is to take care of the pain and the symptoms and the stress of the serious illness during that terminal phase of a diagnosis. So who can receive it? For palliative care, it's anyone who has a serious or chronic illness. It can be someone who has COPD, it can be heart failure, it can be cancer, it could be dementia, and it can be really anybody who's having kind of that physical or cognitive decline and having just increased hospitalizations. There are also many other diagnoses that are out there that, that can qualify someone for palliative care. And with that, people who are seeking palliative care can continue to receive their curative and restorative treatments, including chemo and radiation, including physical and occupational therapy, including going to see their specialist. As you may have heard with hospice, there is a time limit for patients, but with palliative care, there is no time limit for seeing a provider. They can continue to see the provider for as long as the patient needs. Those who can receive hospice, they have a terminal diagnosis. They have to have that eligible diagnosis to qualify for the care, and then they're no longer seeking that restorative treatment. So services that are provided with palliative care, it is a provider that comes to your home. We talk about and go through all of your symptoms, talk about different recommendations. That is why we send our note to the primary care doctor, is that any of these recommendations that are coming from the provider still goes back to that primary care, so that we're not actually making any changes with medications. All the decisions still stay with that center primary care doctor in the center of that patient's care. We talk about advanced care planning. Again, that's the planning that includes your power of attorney, someone who makes the decisions for you if you couldn't. The living will is what you would want if you could not make those decisions. And then a specific one that a lot of times patients get asked when they go into the hospital is, would you prefer to be a full code or a do not resuscitate? if your heart were to stop. So we help to facilitate those goals of care discussions with anyone who's in the home with that patient. Our in-person provider visits are typically about 4 weeks to 8 weeks apart, depending on what the patient needs. Typically, our providers prefer to see that patient after their first visit is to come back in 4 weeks. And from there, we can determine maybe not so frequent. We do have a couple patients that I'm only seeing every 3 months even. And it's just that extra layer of support as this person has their current care. And then we also have extensive community resources. We can connect patients with aging services, with other home cares, with private caregiving resources that they need, even non-emergent transportation. We have all sorts of different resources. So sometimes patients just need that extra resource and then they're good to go, and we just can kind of follow along further apart if they need. The services provided with hospice is entirely focused on pain and symptom management, whether that be through medications or different alternative therapies. They do have in-person interdisciplinary team member visits. With hospice, they cover medical equipment that's needed. They cover related medications that are needed. There is a 24-hour on-call service. So if something happens at 3 in the morning and the family doesn't know what to do, there are staff that are on call that are able to come to the house. There are physicians and nurse practitioners that are on call to make new orders if they need, and they're there 24/7, holidays and weekends as well. There is spiritual care for those with all denominations. There's bereavement and counseling services with our social work department. And then there's 4 different types of hospice care that someone may be able to get. Routine is typically the regular hospice care that someone receives in their home. Respite care is a benefit provided that is covered for 5 nights. We do it in our care center here at Angela Hospice, and it's just come in for the respite care and then be able to go back home. Inpatient care is when symptoms are a little bit more needed to be cared for in a 24/7 management with the nurses. And then continuous care is a type of care where the nurse actually comes to the house for an extended period of time to help get those symptoms under control. So who provides the services? For palliative care, our current Angela palliative care team is a nurse practitioner. We do have physicians if needed, or another person to go see if the nurse practitioner is busy. And then we also have a lot of consultative support from the hospice side, social work and spiritual care if needed for specific patient examples. And then for the hospice team, it's again an all-inclusive interdisciplinary team that includes a care manager nurse, an aide, the physician or the nurse practitioner, spiritual care. There's social work that not only helps with the patient, but also with the family. There's grief and bereavement services. There's multiple different therapy disciplines that include, we have massage therapy, we have music therapy, and then there is quite a number of volunteers that also help out with that hospice care. So payment, a little bit different between palliative and hospice. Palliative is covered with Medicare Part B. It is an outpatient service with our Angela Palliative Care. It is also covered with Medicaid. And then for those with private pay, it may be covered. Sometimes we recommend that the patient call us and ask for the CPT codes for billing that we use, and then have them call their insurance just to make sure that they do cover the services that we provide. And then all are subject to copay depending on the patient's insurance. With hospice, it is 100% covered with Medicare Part A. It is covered with Medicaid in most states. And then again, most private insurers have a hospice benefit and are subject to copay depending on the patient's individual plan. So when is a patient appropriate for palliative or hospice? with palliative, it's really anyone with that serious or chronic illness, anyone who's having increased hospitalizations for infections or that chronic illness that's not getting better and they're kind of just going to the hospital for symptom management. And then those with a need for a goals of care discussion. We talk about a lot of topics that are very, very difficult for families to talk about, which is why it doesn't happen very often. And being able to have that provider come out to the house and kind of facilitate those tough conversations, it helps take the stress off of the family members for both the patient and the family members that are trying to bring these topics up. That's what we're trained to do. So we're there to help facilitate, help figure out these goals and make sure that everyone knows what's going on, everyone's involved, and it just kind of provides some relief that they're not the ones who have to facilitate. And then there's no specific eligibility, the way that Medicare has specific diagnoses and criteria for hospice. Again, it's anybody with that serious or chronic illness that's having hospitalizations and just needs help figuring out what's next in the future. For hospice, it is done with the local coverage determination that is determined by Medicare. They have a list of different diagnoses and where on their disease process people are at and if they're eligible. And then at the same time, even if somebody has and is meeting these eligibility criteria, they may still want to go with palliative because with the hospice, the focus of care is on comfort and quality rather than restorative or curative. So if somebody had like a stage 4 cancer, but they still had options for different chemo or radiation, they probably would fit better into the palliative aspect because they're not ready to stop that chemo or radiation. And those are definitely a good reason to go with palliative. So how to refer to our Angela Palliative Care. The best way to get a hold and figure out what the next steps are to call our main number, which is that top number up there, and then ask for our palliative care team. Anyone here who is answering the phone in our call center is trained to have a little bit of education about palliative care and then direct to the palliative care team so that we can reach out and figure out your needs and figure out scheduling. Another great way to do it is to go talk to your primary care doctor. Pretty much in this area, a lot of people know Angela Hospice and are starting to know that Angela Palliative Care has a group, and they can send referrals to us, and they're aware of how to do that as well. So what to expect for an actual palliative care visit. So the palliative care nurse practitioner comes to your home. You can include all of your friends, any family that you want to have involved in your healthcare decisions. We don't have any limits to people involved in the care, which is kind of convenient, seeing as a lot of times with all the COVID restrictions, you can only have so many people come to the doctor's office. It's great that we can have as many people in the house as the patient would like. The provider or NP reviews your medical history. They ask kind of what prompted the palliative care visit. They'll go through every single one of your medications, any symptoms that you're having, ask a whole bunch of questions about different things, and then do a physical exam. Then after that part, there's an open discussion about your goals and values and beliefs and what you want out of your healthcare. A lot of times, again, these are tough conversations, but you could expect to discuss your feelings and preferences on different topics, including hospital trips, going to see different specialists, different treatment options, what your thoughts are on hospice care, where you're at with your advanced care planning and if you need help with it, and then other life-sustaining options, including things like if somebody would like CPR, feeding tubes, dialysis, chemo and radiation, and so many other different treatment options that are out there. It's all up to what the patient wants out of their care, and it's okay to pick and choose which ones they want. And then after the visit, our Angela Palliative Care team puts together the visit note, and then we'll send it to your provider, whether that be your primary care doctor, or a lot of times, if you do have a chronic disease going on, it might be cancer, it might be a heart disease, we can also send it to that provider that's most involved with your care. What's helpful, especially about palliative care, is that sometimes families and patients aren't sure if they're eligible for palliative or if they should go with hospice. Our providers are always willing to share more information about what hospice entails. We know the eligibility criteria for hospice, and sometimes patients are eligible but not quite ready to proceed with that. And it's totally normal that our palliative care team helps follow along to help share those and educate about the disease process and what might be next. One of our patients was hospice eligible on our first visit. She was getting injections for a blood disorder and was seeing a blood specialist doctor. On our first visit, we talked about how that disease may progress, what it might look like, different symptoms that she may feel, and what might be an indicator of that she's more so ready for hospice care rather than palliative. She at the time was preferring to go get, continue to go the injections. She was doing okay, everything was all right. She was tolerating them, not having too many symptoms. And as time went on that we were seeing her, she was having more symptoms. It was getting harder and harder to go to the doctor's office. She was having symptoms that may have been appropriate for the hospital, but she really didn't want to go. So she had scheduled a visit with her blood doctor, and the blood doctor kind of said, you know, we're noticing these symptoms. It might be time that these injections aren't effective anymore. And on my next visit, when I went out, both the patient and her daughter said, you know, because we had the education on what we were looking at next, and that we knew our options and we knew what was going to happen, we felt so much more comfortable that, yes, we got the news that it's really hard to hear that these injections aren't working anymore, but we knew that the patient is going to be comfortable and cared for and have a plan for what's next. So that's kind of the way that palliative care can help with, even if you're not sure what you want or what's going on, we can help educate and figure out the options and get a plan in place that makes patients and their families feel so much more comfortable with their health care. And that's pretty much it. Are there any questions yet? Anything so far?
Thanks so much, Jordan. No, there isn't any questions in the chat. However, as Jordan has pointed out, now is a great time for you to unmute yourself and ask any questions or concerns that you may have. Jordan's here for a bit to answer any of those questions. So now's your time. So feel free to either put it in the chat and we can share that out with the group and Jordan can answer, or you can unmute yourself and ask a question directly to Jordan. And that is opportunity is now. So go ahead, anyone. Okay, Jordan, we've had the first one come through on chat. And okay. The question is there a cost associated with palliative care services versus the costs associated with hospice care?
Okay. So I can tell you with hospice, it is 100% covered by Medicare Part A. With palliative, because it is an outpatient with Medicare Part B, or depending on your insurance, typically, if it's not 100% covered by Medicare, there is usually your copay, which it's all different depending on different insurances. But if you typically have, when you go to see a specialist, like a $20 copay or a specialist fee, it's typically the same as that. If you have a specific insurance that you want to call us about, we can give you the codes and tell you how to call your insurance and see if they qualify and are covered.
Excellent. Just another question, but feel free, folks, to unmute yourself and ask Jordan directly, but I don't have a problem transcribing out of the chat as well. The other question we had, Jordan, and this guest has said they're sorry they may have missed this in the beginning, but is there a limit on how long you can receive palliative care?
There actually is no limit. We don't have any rules for Medicare, so we really base it off what the patient needs, whether that be a couple of visits and kind of get the plan in place or help with advanced care planning, and then follow along with either phone calls. It can be as short as one visit. It can be as long as the patient really needs. I think we've had a couple that are over a year of being followed and seeing the palliative care team.
Excellent. Well, thanks so much, Jordan. All right, folks, feel free to unmute yourself and ask Jordan any questions directly, or you can feel free to put them in the chat and I can transcribe for you. Jordan, could you go back to the slide that has your contact information up on there? There's been a question about a phone number that you posted. Yeah. There we go.
There you go. That main number is definitely the best way to get a hold of us.